Hello friends, today we are going to discuss from the 21st question of NEET PG. So the 21st question is a case of ascites, okay, and the question asked a alcoholic patient and present with tender distended abdomen. This tender is something important line. So tender means there is something can be perforation can be happen, or there can be anything, peritonitis can happen. But when we have found on ascitic fluid study there is a polymorph, we have more sure there is something inflammation, and this suggested toward our diagnosis toward it is a spontaneous bacterial peritonitis. Okay, so the answer should be spontaneous bacterial peritonitis, as simple as. Next is 22nd question, and it is a digitalis toxicity, digoxin toxicity. And whenever you know already that if there is any digoxin toxicity, there we have to give a case of digivine is the best treatment. Okay, and you already know in case of digitalis we can't hemodialysis, so you have to also know in which cases there is avoid hemodialysis. Okay, so here should be digoxin. We can't here do the hemodialysis, so we have to go for digibind tablets, and this should be the best management. Next is the case of a patient with abdominal pain and jaundice, and on our evaluation anti-HBs antibody is negative, but HBs antigen and anti-HBC antibody IgM type. So it is a case of acute hepatitis B. I just want to show you how it is happening. Just suppose this is the chart I have maintained, and this is the time period. Suppose it is in weeks. Okay, and this is the suppose the serum markers. Okay, so this is the, if it is the 24 week, so our case should be like that. Suppose this should be, and this is the HBS antigen, anti-HBS antibody, anti-HBC antibody, this is the HBE envelope antigen, and there is no window period, and this is the our anti-HBE antibody. So this is lies between this, so it is as simple as this is an acute hepatitis B. Next is MDR TB is resistance to, and it is the isoniazid and rifampicin. But you have to also to know if it is simple rifampicin, it and also can be MDR. So it is MDR TB is isoniazid and rifampicin resistance. Also only rifampicin monoresistance. And what is the treatment? You have to give 18 to 20 month BCL. B for bedaquiline, C for clofazimine, linezolid, cycloserine, L for levofloxacin. And you have to also know bedaquiline should be stopped at 6 months. Okay, next is fatty acid cross the mitochondrial membrane by carnitine. We know it is, if it's fatty acid by carnitine, it is cross the mitochondrial membrane, so it is should be carnitine. Next is a patient with hypertensive patient came with respiratory distress. On chest X-ray, it has been found as a respiratory distress. Respiratory distress, what should be the treatment? So it should be a IV nitroglycerin. Okay. Next is a case of steatoria, that is suppose and malabsorption, but whenever we found it HLA DQ positive, it is totally our diagnosis stick towards celiac disease. And whenever there is celiac disease, we have to think it is a gluten-free diet is the best answer. A clinical case scenario with DKA and asked for next line management. And whenever DKA, you have to think firstly the IV fluid with insulin supplementation. But whenever it is a acute case, you have to manage with regular insulin. Okay, so best should be IV fluid and regular insulin, and long-acting insulin you should give in later cases when the patient is stable and his glucose is under control. So then should be the treatment of protocol for in case of diabetic ketoacidosis. So it is IV fluid and with regular insulin. Next, what is the following image? And this black dot is seen, and this is simply scleromelia perforans. Okay, so this is our scleromelia perforans, and that also a ophthalmological image has been given, and this shows our pseudo exfoliation. Okay, so friends, we have discussed the 21 to 2030 questions, and thanks for watching this video.